Hello and good day to all of our viewers watching wherever you are in the Bahamas and in the Caribbean. My name is Rochelle Nicholas, and me and my team of epidemiologists, we have been called upon to make more awareness of tuberculosis in hopes of reducing its spread in our community. The bacteria behind tuberculosis is called Mycobacterium tuberculosis. It was discovered in the 1880s by Rupert Koch. In the science realm, it can be detected using a staining technique. However, in the day-to-day life, a persistent cough that lasts way over 2 weeks, a fever that lasts way over 2 weeks, and coughing up mucus or sputum with blood, these are all distinguishing signs of you being infected with the bacteria causing tuberculosis. Individuals with tuberculosis can transmit the disease to non-infected people by coughing, sneezing, and/or singing. They can release small particles of Mycobacterium tuberculosis in the atmosphere, and people surrounding them are at risk of inhaling these small bacteria and allowing it to settle in their lungs. This therefore means that close proximity and extended contact with these people who are infected with tuberculosis can increase your risk of catching the disease. Tuberculosis develops in 3 stages. In the primary TB infection stage, some people are asymptomatic where they don't experience anything at all, and others experience some coughing, low fever, and tiredness. In the latent TB infection stage, this is where the bacteria is present, however, it is being suppressed by the immune system and is dormant. This is true for most cases. However, people with compromised immune system, their immune system cannot suppress the bacteria, and it progresses to an active TB infection stage. In this stage, this is where you can experience persistent coughing, persistent fever, and you can be coughing up mucus or sputum with blood. In the active TB stage, tuberculosis can spread from your lungs to other parts of your body, like the skin, the genitals, the liver, the kidneys, the heart muscles, and etc. And you may experience pain in these infected areas. This is known as extrapulmonary tuberculosis. What makes tuberculosis so harmful are 7 protein secretion systems, which allow them to absorb zinc and iron from your body and use it for themselves to grow and reproduce in you. These systems also allow them to fight or interact with our complex immune systems. They allow them to translocate from danger zones like the phagocytes, which fights against bacteria to kill them. These systems allow them to move from those areas to safer zones where they can thrive and grow in your body.
According to Worldometer, as of today, the 26th of February, 2024, the current population in the Bahamas is 414,327. And according to PAHO, the Pan American Health Organization, there were 11 new cases per 100,000 people in 2021. And in 2019, the overall mortality rate of tuberculosis patients was 0.08 in men and 0.09 in women. According to the Ministry of Health and Wellness, tuberculosis was first introduced to the Bahamas by Christopher Columbus in 1492. In 1962, an entire wing of Princess Margaret Hospital had to be dedicated to tuberculosis patients. It was called the chest ward. According to the CEIC, records of tuberculosis per 100,000 persons have increased in 2022, but it has not surpassed our all-time high recorded in the year 2000.
Clinical identification of Mycobacterium tuberculosis can be detected through various diagnostic techniques. These techniques include laboratory tests, chest x-ray, and mantle skin tests. Some laboratory tests include sputum and blood tests. The tuberculin skin test TST was first introduced in 1890 by Robert Koch. It is an intradermal injection of the purified protein derivative. The quantiferon TB Gold test uses blood collection tubes that contain antigens presenting specific Mycobacterium tuberculosis proteins or controls. After blood collection, the tube is incubated for approximately 37 degrees Celsius to 1 degree Celsius for 16 to 24 hours. When incubation is completed, the tubes are centrifuged and the plasma is harvested and is measured by ELISA to trace the presence of Mycobacterium. Treatment for tuberculosis include using drugs such as rifampin, isoniazid, pyrazinamide, and ethambutol, which can last for approximately 6 to 9 months.
It is recommended that if you or anyone you know is suspected to have tuberculosis, to seek immediate medical attention. In the Bahamas, this may mean PMH, doctor's hospital, or even your local clinics. The longer you wait, the more people you infect. But after 2 to 3 weeks of treatment, you can no longer transmit the disease to other people. So seek immediate attention. Don't wait. Don't be shy. Please go to your local clinics and seek medical care. Thank you for listening.
This was Rochelle Nicholas, Kosia King, and Azaria and Bristol bringing awareness to tuberculosis in the Bahamas.